Hello and a heartfelt welcome to Dr. Laura's Health Haven. I'm Dr. Laura, your companion on this incredible journey to thriving as we age. And today I'm so excited to share something with you that could truly transform how you experience your golden years. What if I told you sexual health after 40 is not only alive, it might just be your most powerful chapter yet? Have you ever noticed how quickly society starts acting like your sexuality has an expiration date? At 25 it's celebrated. At 35 it's expected. But after 40, it vanishes. Commercials stop talking to you, doctors stop asking, and somewhere between life's chaos and our own changing bodies, we stop asking ourselves. But here's what no one tells you. Your sexual health doesn't retire. Not at 40, not at 60, not even at 80. In fact, some of the most vibrant, emotionally alive, and physically healthy people I've treated were well past what the world calls middle age. John was one of them. He came into my clinic at 72. A little grumpy, slouched shoulders, said he felt foggy, like he couldn't remember why he walked into rooms anymore. We did labs. His numbers were okay. But you know what wasn't? His connection to his own body. He whispered it, said he hadn't felt desire in years. Not since his wife passed. I looked him in the eye and said, "John, your body is still here. It's waiting for you. You haven't left it. It's just forgotten what it feels like to be touched with kindness." What happened next changed his life. He didn't need a miracle. He needed permission. So let me ask you something personal. When did you stop thinking of yourself as a sensual feeling, deserving human being? When was the last time you explored your own skin? Not out of habit, but out of curiosity. I know for some of you, that's a hard question. Maybe it brings up shame, silence, or even grief. But this space, right here, it's not about shame, it's about freedom. Freedom to reclaim your energy. Freedom to stop aging on someone else's terms. Freedom to talk about things no one ever dared to explain. Because the truth is simple. If you want to stay vibrant, sharp, joyful into your later years, Dr. Midot, ignoring your sexual health is not an option. So tell me this. What's one belief you were taught about aging and sex that you're ready to challenge today? Drop it in the comments. Let's talk about it, without shame. Because your story could help someone else start their healing. Let's get honest about something most doctors won't say out loud. Your body changes after 40. But change isn't failure, it's just information. For men, testosterone begins to gradually decline. That can mean lower energy, slower muscle recovery, even changes in sexual performance. For women, estrogen and progesterone fluctuate like a tide, leading to dryness, mood shifts, and sometimes a disconnect from desire altogether. But here's what no one tells you. That doesn't mean the end of your sexuality, it means the beginning of a new chapter. If you let it. A Harvard study on midlife health found that libido isn't driven by hormones alone. In fact, stress, self-perception, and lack of body confidence play an even larger role than we once believed. Think about that. Your body may shift, but it's how you treat those changes, with curiosity or with shame, that determines what happens next. Let me tell you about Angela, 53. She sat in my office in tears, not because she wasn't having sex, but because she didn't feel wanted anymore. Not by her partner. Not even by herself. We talked about how the drop in estrogen had affected her physically, but we also talked about something deeper, the story she was telling herself. I'm not beautiful anymore. I've lost my spark. This part of me must be over. None of that was true. She just hadn't updated her beliefs to match her evolving body. So we rewrote the story. Together, she started exploring self-pleasure again, not as a goal, but as a practice. She lit candles, slowed down, touched her skin without judgment. Within 3 months, her sleep had improved, her mood stabilized, and her partner noticed something else. Her confidence was glowing. This isn't just emotional. It's biological. When you engage in sexual activity, even solo, your body releases oxytocin, the bonding hormone, that lowers cortisol, endorphins, nature's painkillers and mood boosters, testosterone, which supports bone health, muscle mass, and mental focus. And let's talk blood flow. Every time you stimulate those tissues, gently, mindfully, You're increasing circulation to your brain, heart, and reproductive system. That's not fluff. That's functional medicine. So, what about you? Have you noticed changes in your energy, your desire, or your body's rhythms after 40? I want to hear it. Leave me a comment. This is what aging has felt like for me. Let's rewrite the rules. Together. Because the truth is, your body is still listening, and it's waiting for you to speak to it, with love. You know what breaks my heart? How many people think their desire is broken, when really it's just changed its language? So many of my patients walk in and whisper something like, "Dr. Laura, I just don't feel it anymore." The spark, it's gone. But here's the truth I wish more people knew. Desire doesn't disappear after 40. It simply stops yelling and starts whispering. It becomes responsive, not always spontaneous, and that's normal. Dr. Rosemary Besson, from the University of British Columbia, pioneered research showing how women, especially after 40, often feel desire after intimacy begins, not before. That means you don't always want to be touched, until you're being touched. With presence. That's not dysfunction, that's design. The same applies to men. Arousal may take longer, erections might not be instant. But guess what? That just means the pace has shifted, not the potential. I had a couple in their late 60s, Marcia and Paul, who hadn't been intimate in nearly a year. They weren't angry, just disconnected. They thought it was age. Hormones, the kids moving out, too many years of routine. But when we peeled back the layers, what we found was simpler. They'd stopped initiating touch without expectations. They stopped laughing in bed. They'd forgotten how to play. So I gave them one assignment. No sex, just explore each other's bodies again. For fun, like teenagers with time. 1 month later, Marcia sent me an email. It read, "We made out in the kitchen last night like we were 22. You see, libido doesn't retire, it just grows quieter, and in the quiet you have to learn to listen. So let me ask you something. Have you been chasing the old spark, or building a new flame? What if your desire hasn't disappeared, but is simply waiting for you to meet it differently?" Leave a comment below. Here's one thing I used to enjoy that I want to rediscover. Let's bring curiosity back to the bedroom, because this chapter, it might be slower, but it can also be richer, deeper, and more powerful than anything before. Let's talk about the real enemy here. Not hormones, not time, shame. That's what creeps in at night when you're lying in bed, disconnected from your body, wondering if something's wrong with you. That's what keeps your mouth closed at the doctor's office when they ask, "Any other concerns today?" And you think, would it even matter if I told them I haven't felt desire in years? It matters. It always matters. Shame is silent, but it's deadly. Not in a dramatic, cinematic way, but slowly, subtly. It dulls your spark until one day you wake up and wonder where you went. I've seen it 100 times. Tom was 76 when he sat in my office, barely able to meet my eyes. He'd been widowed for a decade, said he never touched himself again after his wife died. "It didn't feel right," he whispered. "Like I was cheating, or weak, or perverted." I asked him gently, "What if self-pleasure was a way to honor the man she loved? To keep you alive?" He cried, and then he tried. 3 months later, he told me he felt proud of himself again. You see, shame isolates us. It convinces us that we're the only ones feeling broken. But you're not broken. You're human. Raised in a world that never taught you how to age with desire. That never told you it's okay to touch yourself with love. That said, sex is for the young and silence is for the old. Let me say this clearly. There is no age limit on pleasure. There is no expiration date on feeling alive. So, what story about sex and aging have you been carrying that isn't yours? Was it a religious belief? A message from your parents? A shame-filled whisper that said, "Real men don't need this," or "Women after menopause shouldn't want that"? Write it down in the comments. Let's name it so we can unlearn it, because shame thrives in silence, but it dies in conversation. I'm here to remind you, you don't need to be fixed. You need to be seen, heard, and reclaimed. This isn't about chasing your younger self. It's about coming home to the body you have now, with compassion, with honesty, and with power. Are you ready? Because I promise, your body is. Let's step into the part of the story most people miss completely. Your mind. You can eat well, you can take your supplements, you can even try hormone therapy. But if you're walking around with chronic stress, resentment, buried grief, or constant pressure to perform, your body shuts down sexually fast. That's not weakness, it's biology. Cortisol, your body's stress hormone, is a natural enemy of sexual vitality. When it floods your system day after day, it crushes testosterone, weakens blood flow, and tells your nervous system, now is not the time for pleasure, now is the time to survive. And too many of you are stuck in survival mode. I remember Alan, 59, senior executive, 3 grown kids, sleepless nights, a constantly buzzing phone. He came in saying, "Doc, I think I'm broken. I don't want sex anymore." But he wasn't broken. He was exhausted. He was carrying 25 years of unprocessed stress on his back, and still expecting his body to perform like a 30-year-old. When we worked on his sleep hygiene, breathing exercises, even just teaching him to take 10 minutes to himself every day, his desire returned. Not instantly, not dramatically, but steadily, naturally, softly. Here's what most people forget. Your brain is your biggest sex organ. If you're anxious, depressed, overstimulated, or constantly giving without receiving, desire disappears. And let me be clear, this is not just for men. Women especially are affected by the emotional weight they carry. So many are caretakers, running households, managing invisible labor. You can't expect to feel desire when your nervous system is in defense mode. So here's my question to you. When was the last time you felt safe enough to relax? Not just physically, but emotionally. When did you last let yourself breathe? Write that in the comments. Or if you don't remember, say that too. You're not alone. We talk a lot about libido as a hormone problem. But sometimes it's a boundary problem. Sometimes it's a burnout problem. Sometimes it's a self-worth problem. You are allowed to feel tired, but you are not meant to live there. Sexual vitality isn't just about arousal, it's about aliveness, and that begins in your mind. So, I want you to ask yourself one thing today. What can I remove, or gently release, that's been weighing me down sexually or emotionally? Start small. It could be guilt. It could be a relationship that drains you. It could be the expectation that you should be the same lover you were 20 years ago. You don't have to be who you were. You just have to show up as you are, and let that be enough. Because that's where healing starts. And desire follows right behind. Let's get practical now, because vitality after 40 isn't just about what's happening in the bedroom. It's what's happening in the other 23 hours of your day. Your body is an interconnected system, and when you neglect the basics, your sexual health will always be the first to suffer. So let's look at the 4 most underestimated pillars of sexual wellness. Movement, nutrition, sleep, touch. 1. Movement. You don't need to run marathons. A brisk 30-minute walk, 5 days a week, is enough to improve blood flow, regulate hormones, and support heart health. The Blue Zones Project, which studied the world's healthiest people, found that those who lived longest and loved deepest didn't go to gyms. They moved naturally. They gardened, they walked, they danced. And their libidos? Still alive and well into their 80s. Nutrition. Forget pills and magic drinks. A Mediterranean-style diet, rich in omega-3 fats, colorful veggies, whole grains, and lean protein, has been proven to boost circulation, balance blood sugar, and improve hormonal health in both men and women. Harvard researchers found that men who ate the most flavonoid-rich foods, think blueberries, dark chocolate, citrus, had a 14% lower risk of erectile dysfunction. Ladies, that same nutrition helps maintain vaginal tissue, balance estrogen levels, and reduce inflammation that can affect arousal and comfort. 3. Sleep. You cannot heal or desire without rest. Testosterone production happens during deep sleep. Miss it, and you're running on fumes. A University of Chicago study showed that sleep-deprived men had 15% lower testosterone levels within just 1 week. So if your libido feels off, check your pillow, not just your pants. 4. Touch. Not sexual touch, just touch. Skin-to-skin contact increases oxytocin, reduces stress, and reminds your body that it's still alive, still connected, still deserving of love. Even massaging your own shoulders, holding your partner's hand for 60 seconds, hugging someone for a full breath. Touch tells your body, you are safe, you are human, you are loved. So now, I want to hear from you. What's one daily habit you know you could improve that might support your sexual vitality? Is it your sleep? Your movement? Maybe adding berries to your breakfast? Or turning your phone off 30 minutes before bed? Comment below with one thing, just one. Start there. Because here's the truth. You don't need to overhaul your life. You just need to begin. And your body? It will thank you for every little act of care. Not someday. Right away. Let's talk about the heart of intimacy, connection, communication, play. Because desire doesn't just live in hormones. It lives in words, in touch, in the small ways we reach for each other and for ourselves. Too many couples I meet are suffering in silence. They're sleeping side by side but feel miles apart. No fights, no betrayal, just a quiet disconnection. I had a couple, Jorge, 61, and Fatima, 59. They told me, we love each other, but we haven't been intimate in years. We don't know how to talk about it without feeling ashamed. I gave them one simple tool, the yes, no, maybe list, originally developed by Dr. Emily Nagoski. It's a list of intimate activities, not just sex, where you each mark, yes, I enjoy this, no, not for me, maybe, I'm curious. They came back to me 3 weeks later beaming. They said they'd laughed, blushed, even rediscovered kissing, not the quick peck on the cheek kind, but the let's turn off the world for 5 minutes kind. You see, communication doesn't kill desire, it protects it. We've been told desire should be spontaneous, electric, magical, but after 40, intentional desire is where the magic really lives. So here's my question to you. When was the last time you talked about intimacy, not as a problem, but as a possibility? Can you carve out 10 minutes tonight? Not to complain, not to demand, but to ask. What makes you feel close to me? What touch do you miss? What do you want to try, even if we giggle through it? Playfulness isn't immature, it's sacred. It's how your nervous system feels safe enough to open again. Even if you're single, this still matters. Talk to your own body with that same spirit. Explore what feels good now. Light a candle, use a soft lotion, be silly, be curious, be kind. So, share with me in the comments, what's one thing you miss about feeling connected, either to yourself or your partner? No shame, just truth. Because connection starts with honesty, and every moment you choose to lean in is one step closer to home. Let's get something straight. Asking for help isn't weakness. It's one of the strongest, most courageous things you can do for your body and your future. And yet, too many people wait. Until it hurts, until a relationship is strained, until years go by and they don't remember what desire ever felt like. But here's what I tell every patient who walks through my door. Sexual health is a vital sign, just like your blood pressure, just like your cholesterol. The Johns Hopkins School of Medicine now teaches physicians to view sexual well-being as an indicator of overall health, especially in aging adults. If something's off, your desire, your function, your comfort, it's not just aging. It's worth investigating. Sometimes it's medical, hormonal imbalance, side effects from medications, like antidepressants or blood pressure meds, blood flow issues, vaginal dryness or pelvic floor disorders, erectile dysfunction caused by undiagnosed diabetes or cardiovascular risk. Sometimes it's emotional, trauma, grief, depression, relationship wounds. Sometimes it's just life, and it's okay. I had a patient, Noreen, 67, who came in convinced she was done with sex. She thought it was a closed chapter. But what we found? A thyroid imbalance, a side effect from a medication, and deep loneliness she never voiced. 3 months later, with support and care, she said to me, "Dr. Laura, I feel like myself again. Like I'm not invisible. You don't have to suffer in silence." There are pelvic floor therapists, sex-negative counselors, doctors who will listen without judgment. Yes, we do exist. and safe communities, like this one, where your story is valid. So here's your moment of truth. Is there something you've been ignoring, hoping it will fix itself? A discomfort, a loss of interest, a question that's been quietly gnawing at you? Drop it in the comments, or write it down privately. But don't bury it, because the longer we wait, the more we reinforce the lie that this part of life doesn't matter. But it does. You matter. Your pleasure matters. Your healing matters. And seeking help isn't the end of your story. It's the start of a brand new one, where you reclaim what was never meant to be lost. Take a breath with me. Seriously. Right now. Inhale. Feel that? That's life, still pulsing through you. Not past its prime, not worn out, just waiting to be remembered. We've been told a dangerous lie, that sexual vitality is a young person's game, that after a certain age we're supposed to settle down, slow down, and stop asking for more. But let me tell you something with all the love in my heart. You are not expired, you are evolving, and evolution is power. Your body may not move the same way, your arousal may take a little longer, your skin may sag where it once was tight. But do you know what you have now that you didn't at 25? Wisdom, depth, courage, awareness. The ability to touch your body with intention instead of insecurity. The right to ask for what you need without apology. The freedom to slow down, breathe deeper, and choose pleasure on your own terms. I've worked with thousands of patients over the years, different backgrounds, different challenges, but the one thing that separates those who thrive from those who merely survive, they say yes to trying, to healing, to feeling, even when it's awkward, even when it's slow. So let me ask you something that could change everything. What part of your body, or your story, are you finally ready to love again? Not fix, not perfect, but love. Leave it in the comments. Let the shame go. And let someone else reading know they're not alone. Because you're not. You are part of a quiet revolution. People over 40, 50, 60 and beyond, who are waking up, not shutting down. You're part of a movement that says, my age does not disqualify me from pleasure. It deepens my right to it. So here's your invitation. Start small. Tonight, turn off your phone. 30 minutes earlier. Put your hand on your chest. Breathe. Touch your skin without judgment. Let your body know, I haven't forgotten you. I'm here. I'm listening. Because you don't need to be 25 again. You just need to be present. And that is more than enough. If this message stirred something in you, hit that like button. Subscribe if you want more real conversations like this one. And please, share this with someone who needs a gentle nudge back into their body, their truth, their life. Because we are not here to disappear, we are here to thrive. See you next time. Dr. Laura.